Hello, my name's Jonathan Smart. I work for Innosonian Europe, the makers of the Brayden Manikin. I'm also a volunteer community first responder with South East Coast Ambulance Service, and we use the Brayden Manikin to teach CPR in our community. You might wish to know how you should clean the Brayden Manikin. Okay, you obviously have your own protocols that you should follow, but what we would recommend you do the following. If the students are doing mouth-to-mouth resuscitation, then we would suggest that between each student, you thoroughly wipe around the mouth and the nose area of the mannequin using a disinfection type tissue or some sort of sanitizing fluid. Also around where the students are putting their hands. You should do this between each of the students. At the end of the class, we would recommend you do the following. You remove the face of the mannequin. Okay. Detach also the O-ring as well. And then you can immerse this in the UK, it would be Milton fluid, in France, Anios, in Germany, the Boda disinfection liquid. Any sort of sanitizing agent like that, you can immerse in and then allow to dry thoroughly, okay? Within the mannequin, take off the chest skin, okay? Pull back the chin piece, take out the valve block, okay, and detach the lung. And at the end of the class, after you've trained the students for the day, discard the lung, okay. The valve block, you can remove the filter. There's a small filter, which you should then discard, and open the valve block, and you'll see a little flap valve, which you should also discard. These two pieces you can also immerse in the Milton or in the Anios or the Boda chemicals, etc., as you have done with the face piece. You would then reverse the procedure, okay, and here's one I've done earlier to save a bit of time. Okay, so put the filter back in, the flap valve back in, push the valve block back together and attach the lung, okay, a new lung. You then attach, just going in reverse as to the way you were doing before. Push down the chin piece, attach the lung, put the chest skin piece on again. Okay. Take the face piece, which has now been cleaned in the Milton or the sterilizing solution. Put the O-ring back in and make sure the O-ring is in the groove, correctly positioned in the groove. Position the mask so it's inverted or inside out in this particular way. Secure the O-ring onto the projection coming out of the face of the mannequin. Pull back and then attach. To make it convenient for you, we've recently introduced a 24 pack of 24 lungs, together with 24 filters, together with 24 of the flap valves that go in the valve block. So at the end of each class, you can replace the lung, the filter and the flap valve, and having a convenient pack of 24 means it's more cost effective for you to buy in this particular way. So these are available for Innosonian Europe or from your local distributor.